Hello, this is Dr. David Green, CEO of the TEX-PAIN Network. Today's topic is the top 10 things you should know about stem cell procedures. Stem cell procedures for musculoskeletal conditions are now a reality, and they are booming. You have professional athletes, people like Heinz Ward, Bartolo Colon, weekend warriors, such as the mountain biker, grandfathers, executives. It really is mainstream. The first thing to know is that modern stem cell procedures have no ethical issues. There's no fetal tissue used in the material. It's only either adult stem cells or amniotic-derived. The amniotic come from a consenting donor after a C-section, but nothing involves fetal tissue anymore. The second thing to say is they're showing promise for degenerative and rheumatoid arthritis, SI joints and spinal joints, tendonitis, such as the Achilles tendonitis, rotator cuff, elbow, plantar fasciitis, and ligament injuries, such as in the knee, sports injuries, diabetic wounds that are not healing well, and stress fractures. Stem cells are like a blank slate. They start from an undifferentiated state, and they convert into any number of necessary cells: skin, cartilage, tendon, ligament, muscle. And a lot of it depends on what type of environment they're placed into as to what they become. The fourth thing to know is that they can actually heal injury. Traditional treatments with cortisone act as a band-aid. They don't heal anything, but they're good for pain relief. The regenerative medicine treatments offer the potential to heal the damaged soft tissue and cartilage. This is cutting edge. It's helping get athletes back on the field faster, avoid surgery, and it can delay or avoid the need for a joint replacement. The fifth thing is, I've already touched on this, current treatments do not use embryonic stem cells. The use of adult stem cells in research and therapy is less controversial than embryonic stem cells because their production does not require the destruction of an embryo. Amniotic fluid stem cells are intermediate between embryonic stem cells and adult stem cells. They have some potential to develop into different cell types, but they are not pluripotent. So they do know when to stop replicating. That was one of the problems we had in the past research, was that embryonic stem cells, they just keep going. They don't know when to turn off. That can actually develop tumors. You don't have that problem with the current ones being used. There are 4 different types of regenerative medicine procedures. The first is bone marrow derived, which is probably the most common. Bone marrow is aspirated from a person's hip. It's then immediately processed in the room and then injected into the problem area, knee, the shoulder, what have you. Fat-derived stem cell procedures take a lot longer, about 2 hours, and they involve adipose tissue from the patient being processed as well. Amniotic-derived is one of the newer types. It's probably the easiest because it doesn't come from yourself. It comes from the amniotic fluid of a consenting donor after a scheduled C-section. It goes through an FDA lab. It's been very promising with results. And the PRP therapy is indirect stem cell therapy. It's a simple blood draw from your arm. The blood is processed, spun rapidly, and then you get a concoction that has increased platelets and growth factors. And the stem cells come after you inject it. It actually calls them in from the body. A little bit more about amniotic-derived stem cells. They're obtained from consenting donors after a scheduled C-section, processed at an FDA-regulated lab. When they're injected into another human after that, it's an immunoprivileged situation, meaning that the body who's accepting the fluid does not reject it. There's no host versus graft reaction, anything like that. There are very impressive qualities in the amniotic fluid derived. There's a high concentration of stem cells. There's hyaluronic acid, growth factors, proteins, and antimicrobial properties, meaning it has a very, very, very low incidence of infection. This amniotic-derived stem cells have been used tens of thousands of times worldwide without adverse events. It's being used in cardiac, ophthalmology, orthopedic, pain management. It's been remarkable. Small studies to date are showing excellent results for stem cells being used for knee arthritis, elbow epicondylitis, such as tennis or golfer's elbow, degenerative disc disease, plantar fasciitis, ligament injuries, rotator cuff injury, and Achilles tendonitis and tears. The ninth thing to know is that it's not yet covered by insurance. Despite the exceptional results being reported, it usually takes insurance companies several years to cover new technology. The cost of the procedure ranges. If surgery can be avoided, that can save considerable costs and disability, so you have to put it in perspective. I'll give you an example. Back in 2004, the FDA approved this revolutionary technology, which was the artificial disc replacement for replacing the spinal disc. Now, even though it was FDA approved, and studies have shown that it worked well, insurance companies didn't start covering those for years afterwards. Number 10 is that these are outpatient and exceptionally low-risk procedures. PRP therapy simply involves a blood draw. Fat and bone marrow derived is tissue that comes from you. Amniotic-derived is immunologically privileged and it has a long track record. So there's minimal adverse event potential and a potential huge upside. So the risk-benefit ratio is heavily in favor of the benefit. The top non-operative pain management in the Dallas-Fort Worth Metroplex area is through the TEX-PAIN network. There are several clinics accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the TEX-PAIN network. Your pain stops here.